Thank you so much, everybody, for joining us today. My name is Nayomi Valdez. I'm the Director of Public Policy here at the ACLU of New Mexico. We've asked you all to come here today to help amplify the voices of advocates and experts across the state, asking our legislators and governor to take an evidence-based, comprehensive, and long-term approach to strengthening public safety. Everyone you're hearing from today lives and works in our communities, and they are experts and advocates working on some of the most pressing social issues affecting public safety in New Mexico. We feel and see the ongoing struggles every day that everyone else does when it comes to things like substance abuse disorder, housing crisis, behavioral health crisis, violence, and crime. We know that the solution to these complex and deeply systemic issues is not mass incarceration. In fact, it's just the opposite. Evidence shows that in many cases, incarceration may actually increase crime rates because prison is deeply traumatizing. And once someone is entrenched in the legal system, there are many barriers to escaping it. That cycle of recidivism affects all of us. It's our hope that the legislature will continue in their commitment to bolster investments in behavioral health, housing, diversion programs, treatment programs, and education that will ultimately transform our state for the better. We must resist the temptation to look for quick fix policies in the form of punishment, more law enforcement, criminalization, and things that ultimately harm our communities and don't make us any safer. So with that, I will hand it off to our first speaker. Emily Keltenbach is the Senior Director of State Advocacy and Criminal Legal Reform for the Drug Policy Alliance. Go ahead, Emily.
Thank you so much, Naomi, and good morning, everyone. Again, my name is Emily Kaltenbach, and I work with the Drug Policy Alliance, a New Mexico and national organization working to shift drug use from a criminal issue to that of a health issue. Having been raised in rural New Mexico and working in health planning and health policy in the state now for 30 years, I've seen the public suffering and the private struggle with addiction, but it's more visible than ever and definitely a huge concern to all of us. But recently, I've been in conversation with local addiction medicine doctors to get their stories and hear their ideas for addressing the overdose crisis that we have been in for generations in this state, but is definitely getting worse. And I'd like to share with you today some of what I heard from them. These physicians shared that their patients present with severe trauma, homelessness, and health and economic crises, and how often those issues, those social determinants of health, drive their substance use, not the other way around. These doctors see how generational poverty plays out in the present lives of their patients and watch how in moments of crises, whether that's an overdose of a loved one or a loss of a job or a home, that meaningful support or treatment isn't always available to them. And this is how addiction starts. This is what makes it so difficult to treat. But time and time again, as Naomi said, we turn to criminalization and punishment as the response to drug use. Punishment in the form of jail or prison time only exacerbates the underlying causes of substance use. It leaves people with criminal records that cause more barriers, more harm, more isolation for them down the road. These folks experience trouble accessing housing, education, employment, treatment, and other public benefits. And given the fact that these resources are key determinants or key social determinants of health, drug convictions only disrupt and eliminate people's access to the necessary resources they need to live healthy lives. So really the punishment disrupts healthy lives. Punishing people who use drugs rather than providing them with needed resources defies widely accepted understandings of drug use as a health issue. So making treatment and social services like housing available, affordable and accessible should be our priority this session. We need to shift from a criminal approach to a health-based approach. That means our neighbors, our coworkers, our family members, our students, and our kids should be able to access social support and services they need when they want it in their community. So I'll just end reiterating that people who are suffering really need support, not punishment. So thanks, Naomi, for the opportunity to speak today.
Thank you so much, Emily. And next we will go to Rachel Biggs. She is the Chief Strategy Officer for Albuquerque Healthcare for the Homeless. Thank you for being with us today, Rachel.
Thank you, Naomi. I'm honored to be here today at Albuquerque Healthcare for the Homeless. We're a community health center and we serve people experiencing homelessness throughout Bernalillo County. And we are seeing an increasing number of people seeking our services. We know that homelessness increased in New Mexico by 50% between 2022 and 2023, and New Mexico had the second highest rate of a percentage increase in homelessness in the country over the past year. And so we are seeing this session as a really great opportunity with the record-breaking year again of looking at investments in housing as being foundational to creating strong and healthy communities. We know housing is one of the best investments that we can make in our communities in order for all of our community members to be safe and secure, and it will last for generations to come. As Emily said, we see the impacts of generational poverty on the clients that we serve, on people experiencing homelessness throughout the community, and we know that it doesn't make sense to spend money and time and effort on wasting precious resources on criminalization tactics that do not address the root causes of homelessness and do not, in fact, make our community safer. What we do have evidence to support is that investing in affordable housing and permanent supportive housing and subsidies to make sure people can afford their housing is what creates a safer environment for everyone in the community. We have seen the impact of this in our own communities. We have data to support it through the Heading Home initiative. We have data to support it through what we've seen in Denver and how they've invested in housing instead of criminalization. And we know that the impact this has on communities when we invest our precious resources in housing. We also know that people with disabilities are much less likely to become victims of crime when living in safe housing than on the streets. And we know that people experiencing homelessness are in fact 25 times more likely to be victims of violent crime than someone that is housed. So for us, the biggest investment in the community's safety is housing and making sure that those services that Emily spoke to are available. When services are available, people seek them, and we have good evidence to support that. And we don't need to mandate treatment. We don't need to mandate that people access those services. As long as they're available, people will seek them out. And as long as people have a foundation of a safe home that they can afford, they can work on things like substance use and mental illness and become healthier in their communities and become safer. And that contributes to the safety of everyone living in New Mexico. So we're looking forward to a productive session this session and hopefully some big investments in housing and the safety of our communities. Thank you so much for the opportunity.
Thank you, Rachel. And next we will go to Vanessa Hulliger. And Vanessa is an impacted mother and advocate for young people in our state, navigating the juvenile justice system here in New Mexico. Go ahead, Vanessa.
Hi, good morning. My name is Vanessa Hulliger, and I appreciate the opportunity to be here today to tell my story. I want to start out by telling you a little bit about my son, Noah. Noah was always very bright and did very well in school. He started playing football at the age of 8. He was not naturally athletic and he definitely lacked confidence, but he made up for it with his intellect and hard work. He grew to love the game and became quite good. Noah's biological father struggled with substance abuse and mental health issues and was in and out of Noah's life. And this affected Noah more than he would like to admit. February 2020, my son Noah had transferred to a new high school where he met a new group of friends. We noticed a change in Noah not long after the pandemic shut down the schools. His grades began to drop. He became more defiant, going out with these new friends and not obeying curfew. Over the next couple of months, this escalated to experimenting with alcohol and drugs, making decisions that were out of character, and becoming more withdrawn. We attempted to get him into therapy, but we were put on a waiting list. A few months later, he finally was able to see a therapist, but was quickly referred to another who specialized in pediatric drug abuse. We were placed on another extremely long waiting list. His drug experimentation quickly turned into addiction. There were limited resources lots of waiting lists, and what I felt was nowhere to turn for help. On October 29th, 2020, at 9:13 p.m., I received a call that forever changed my life. I was informed by medical staff that my 17-year-old son had been shot and I needed to come immediately. I walked in and saw my Noah barely conscious. I was able to kiss him, tell him I loved him, and to keep fighting before they rolled him back for emergency life-saving surgery. He had been shot 4 times. He suffered a collapsed lung, broken ribs, internal bleeding, and a fractured pelvis. My world completely crumbled when I found out the events that occurred that night. He had been involved in a drug deal that turned into a shootout, where another was fatally wounded. December 8th, 2020, Noah was 17 years old, halfway through his junior year of high school, and now facing serious adult charges. 2 years and 2 trials later, Noah was convicted and sentenced as an adult to 29 years in the Department of Corrections. December 8th, 2020 was the last time I was able to hold him longer than 3 seconds, hold his hand, or touch his beautiful face. He will be in his late 40s when I can do that again, even though he was a child who made a horrible mistake. The past 3 years have been nothing short of a nightmare for my entire family. We continue to struggle mentally, financially, and at times physically. Noah has 2 younger siblings. They have had to transfer schools and are receiving therapy to cope with the trauma they've endured through this entire situation. I have a daily battle with anxiety and depression. How do I continue to raise my younger children with this intense fear that this could happen to them? My story is not unique. I share this story with far too many other people. Situations like this do not discriminate. I look around the support group I created for families like mine, and I see families from all walks of life. The lack of resources is a common theme amongst all these families. I believe in rehabilitation and second chances. I've learned that it's crucial to address the root causes of incidents like these. We need better access to mental health services, drug rehabilitation programs, and resources for families who are financially struggling. It's essential to create a society that focuses on healing and providing opportunities for growth. This is why I have dedicated my time to helping families in similar situations to my own. My hopes are to continue to do all I can to improve conditions for youth in New Mexico. I want to prevent this from happening to any other children. No family should feel this loss. No mother should lose their child to guns, drugs, or prison. Thank you.
Thank you, Vanessa, for being with us and sharing your story. With that, I think we can open it up for questions.
If you would like to ask a question, you can use the raise your hand function, and then Maria will go ahead and invite you to talk, and you'll have to accept that invitation. You'll come off mute, or you can also use the Q&A function.
I see one question in here from Damon Scott. If Damon, would you like to unmute and answer and ask your question?
Hello.
We can hear you. Yes, go ahead.
Okay. Thanks. I just had an initial question, which is what is of specific concern out of Santa Fe right now in regard to this topic, you know, in terms of the legislative session coming up?
Any of our panelists want to take that one? I'm happy to jump in. Okay, Damon, I think, yeah, sure. Happy.
You know, if there's any specific bills that have been filed, or just, you know, what you all are hearing that that is, you know, prompting this this news conference today.
Right. So already we've seen a number of bills in pre-file attempting to increase sentences, stiffen penalties for various crimes. and the creation of new crimes. So all of those are drivers of what we're getting at here, which is mass incarceration, putting folks in jail for various things, rather than investing in diversion or rehabilitation in a meaningful way. And so the theme is already taking a tough on crime approach. And we've heard various rumors that I don't necessarily want to perpetuate, but some pretty terrifying narratives coming from law enforcement. We've heard themes of cracking down on the juvenile violence happening in some way as well. And all of those things are, it fly in the face of what we know is going to be effective in addressing public safety.
Sure. Any sense of how the governor feels about any of these pre-filed bills on law enforcement?
I don't have a sense on that, but I would like to answer your original question. I think what we get concerned about is when we start to focus solutions on things that we know won't have an impact on making our communities safer. And so when we see the impact of huge billions of dollars of investment that could be being made in services, mental health treatment, housing, things that we know actually address the root causes of crime or poverty or homelessness, we want to make sure that we don't miss that opportunity. So I think this is an effort to really get out there ahead of the session and be clear that investments need to be directed at the right things and that we shouldn't be diverting our resources and our attention and a precious 30-day session on things that we know won't have an impact on addressing what lawmakers are really interested in addressing and what community members are really interested in addressing, which is making our communities safer, making sure everyone has access to the services that they need to thrive and live a safe and healthy life. So that, to me, is our biggest concern going into the session. There's great opportunity and we don't want that to be wasted.
Yeah, and I'll just add, one of the issues that we have been tracking and are hoping is addressed this 30-day session in the budget is really, we know there are additional revenues coming in. So for example, our cannabis excise tax revenue that's coming in, we'd really like to see those dollars reinvested back into community for treatment, for harm reduction, for housing supports. Those dollars, that makes perfect sense. Here are new dollars coming in, and we should be, spending them on substance use prevention and treatment and all of the services and supports we laid out. So that is one area that I hope will be addressed this session.
Well, thank you. I read about poverty and homelessness issues, and so I'd love to follow up with a few of you on this topic going forward. I appreciate your answers.
Thank you, Damon. And I see Robert Knott and Nicole Maxwell both have questions. So, Maria or somebody can.
I think Robert and Austin are both, I think I unmuted them both. Maybe Great. Robert first.
Yeah, hi, good morning. Thanks for holding the conference. And I know several of you and your voice has been helpful, so thank you. I've got several questions, but I'll ask one and then step back for the reporters to weigh in. I'm curious right now, are there some initiatives, legislative initiatives, that fall into line with what you want that have been pre-filed? I have been watching the bills, but I'm trying to find some that align with what you're suggesting right now. And again, I have one or two follow-ups, but those can wait until everybody else asks a question.
I will just raise one. I believe it's been pre-filed, but I'm not sure if it's up on the website yet, but there is effort to increase access for young people for medication-assisted treatment in outpatient settings. So medication-assisted treatment is evidence-based treatment for opioid use disorder, and that might be buprenorphine or methadone, but we know it's very effective as a treatment and also effective for young people. And so I'm hopeful that that bill gets some traction as we increase, again, just as we talked about today, increasing availability and accessibility is key for our young people. and also will prevent some of the harms that we see later on if they don't have access to treatment.
Thanks, Emily. I can wait for the other reporters to weigh in if they like.
Yeah, I've got a question to follow up on something that Rachel Biggs said. I think, just to paraphrase, I think you said we don't need to mandate treatment, and I think that you know, there's some alarming trends in other states in this same context. We saw late in 2022 that New York City Mayor Eric Adams put into motion a plan expanding the use of force to drug and hospitalize people against their will. We've also seen the governor of California sign a law that does something similar. So I guess, Rachel, are you hearing any proposals like that might come up?
Thanks for the question, Austin. No, I'm hearing what's happening in New York and California, and we're seeing this as a trend across the country. So we are really trying to focus on preventative measures and making sure the investments are targeted to evidence-based solutions that we know work. So when we talk about housing first and making sure that housing is available and services are available and voluntary, not mandatory, has been something that we've always advocated for. And we see the benefit of that over decades of research, both locally and nationally. And so as a healthcare for the homeless provider and a housing provider in the community, we just want to make sure that resources are still invested in those evidence-based solutions. We get concerned when we hear people talking about mandatory treatment. I haven't heard of any proposals this session. Others might have on the panel, but what we want to make sure is that we're not getting sidelined and sidetracked in our resource allocation by talking about these things that we know won't have an impact. And so at Healthcare for the Homeless, we strongly believe that if you make the services available, people want them. I think we hear that over and over again. Harm reduction outreach on Friday nights, and people come up and they want access to Suboxone and medication-assisted treatment. They want treatment on demand, same-day services. If it's available, people will seek them, and I don't believe we have to mandate them.
Thank you so much, Rachel.
Thank you. And we have Nicole Maxwell next.
Hi there. My question is, it's actually posted in the chat, is in a perfect world, what would you like to see done with respect to rehabilitating people rather than incarcerating them?
That's a great question, Nicole. A perfect world is hard for us to imagine, right? But I think in terms of what's possible, we can be making meaningful investments to interconnect services. Giving meaningful opportunities for rehabilitation and reform means opportunities for achieving economic dignity, getting an education. Graduation rates are a major indicator of crime in any state. And housing, treatment, all of the things that we're talking about today, building up that pipeline and the infrastructure so that these things are accessible and are the first tool that we reach for in our toolbox, rather than, entrenching somebody into the legal system, into the carceral system, and then working backwards from there, which creates a whole lot of other challenges that just aren't necessary or helpful. Any of my fellow panelists want to chime in there?
Well, just in respect to drug use, I mean, I think we've said today, treatment on demand is really important. When people are ready and want it, to have that access to treatment is critically important. So in a perfect world, people, there wouldn't be waiting lists for the services and supports that people need. I think also there's some stepping stones to that perfect world that New Mexico can start thinking about. Right now in New Mexico, if you have trace amounts of most drugs, it's a felony. And we know, as I mentioned before, those create these barriers. It's just this cycle where people can't live healthy lives if they're really struggling with a felony conviction on their record. And so a great step would to make those misdemeanors and eventually think about how drug use is truly treated as a health issue and not a criminal issue at all. And so I hope we start embracing and looking at our sentencing structure for drugs, because I think there's some simple common sense steps forward so that we can wrap people around with the compassion and the healthcare and the harm reduction that they need to start their healthy lives again.
Thank you, Emily. And Vanessa, I'd love to hear from you on this question as well. You know, thinking about your son's experience, what would that situation have looked like if in a perfect world?
Yeah, so we never got the resources we needed before this happened. And so now he's been put into a system that lacks resources itself. And so now he's, I feel like he's going to be the one that we're going to have to work backwards with after this whole thing is over with. And so if he would have gotten the counseling he needed, the drug therapist that he needed, we could have worked on those issues before he went into the system. And now he's in a system, like I said, that has very limited resources, and he's still a young man, so he still needs those resources.
Thank you, Vanessa. And I know Robert had another couple of questions, and Gregory, I see you're off mute as well if you have another.
Thank you very much. This is for Vanessa, and I guess for anyone else who wants to answer. Is there something you'd like to see? What kind of bill or bills you'd like to see legislators propose regarding juvenile detention centers?
So I'm not an expert on the legislation side, but I do think that they need to come up with something that's going to provide these resources specifically in the juvenile detention centers that are lacking so desperate. Like, they're very desperate right now. These children need the resources to be able to rebuild and to come out and be a productive citizen, and not risk the chance of going back into the Department of Corrections.
Thank you.
Naomi, can I address that for a second?
Please do.
Sure. Hi, I'm Ben Bauer. I'm the Chief Public Defender, and the Law Offices of the Public Defender is also a member of the NM Safe Coalition. On what I want to say about the juvenile issues is we have a concern that there's been a lot of talk about creating more across-the-board penalties and procedures for juveniles. And I think that it's dangerous because it doesn't treat the child as an individual. And there are guns, our society is awash in guns. And unfortunately, some juveniles are going to have guns. And I completely understand why that is not a good thing. Unfortunately, some of these kids don't. And some of the policies that are being proposed would hold a child before they're found to have actually committed an offense, before they're adjudicated, for weeks, months, even more on some of these things based upon across the board policies. And I think, that idea of deterrence sometimes doesn't work with juveniles. They're not reading the newspaper, they're not necessarily watching the news, and they act without thinking. Some of those children may need severe punishment, which could include years of incarceration, but most of them don't. And these across the board policies put us in a place where we are going to do more damage than we solve, especially when, and to answer the question before, juvenile detention centers have to be addressed. The conditions that kids are kept in has deteriorated over the last few years. I think COVID is part of that, and possibly just neglect of us as a community of what it means to be a kid in a detention center. It's really unconscionable for us to hold children in this way, whether or not they've committed an offense. And we have a responsibility as a community to improve that, because those kids are going to get out. And when they get out, they're going to be in our community. It is in our best interest to treat them well when they are in our care.
Thank you for that, Ben. Right, Robert.
Thank you. Thank you for this. So 2 questions. Maybe the first one would go to Rachel. As I work on a separate story about housing initiatives, is there anything so far that we've seen filed, including, I believe, Senator Rodriguez has a request for 500 million for the Housing Finance Authority. Is there anything yet happening to help us with affordable housing, which for your purposes is very important with reducing crime and keeping us safe? But, you know, on a less severe level, a lot of people are just coping with having a tough time finding a place to live, which is impacting our workforce. So curious right now if you have any proposals or are you seeing any that address this? And then I have one more follow-up after that.
Yes, thanks, Robert, for the question. We are supportive of Senator Rodriguez's bill to finance 500 million to the Mortgage Finance Authority. Really excited to see that bold investment in the MFA. That is kind of our one avenue that we have to build and rehabilitate affordable housing across the state. And it has had great success in doing that over the years through MFA. So we're very supportive of that, very excited. Another thing that we have seen, we have advocated for is the linkages program, which is permanent supportive housing. So that's a housing subsidy out of the Human Services Department, specific to people with a mental illness or substance use disorder. And we have been advocating for that to be expanded. You know, the executive budget is looking at $1 million recurring and additional investment. Last year, there was another $1 million investment. So expanding that program is a priority, and we're excited to see that have some support. And then I was part of the Governor's Housing Investment Council that met in the interim, and we made some recommendations on investments in the executive budget. It had $250 million to the Finance Authority for the Enterprise Opportunity Fund to build more housing across the state as well. So trying to tackle housing from a lot of different angles, just getting more housing online, supply, affordable housing, and the housing subsidies are all really important things. And then Representative Cates has a bill on source of income discrimination and banning source of income discrimination statewide that was just pre-filed as well. So looking at barriers to accessing housing is always important. But we're really excited about the potential for those big investments this session. We need them. It's a great way to invest a surplus of revenue.
Thank you. I have one more question, if that's okay.
Absolutely.
It's probably my only quote unquote critical question, but I know you all hear it. What do you say to the side that says, yes, your ideas are really good. We know it's going to take time to get to those root causes, but in the meantime, people are still being, you know, victims of crime, including the homeless. That's a good part. And I'm sure those who are facing all sorts of problems, but how do you push back against that? Let's be tougher on crime force that seems to be coming out, when probably some people, maybe a lot of people, kind of want that as well.
Well, I'll answer, and then I'd invite, you know, Ben or Emily or any of the experts on this panel to join in. But I would say, you know, that's actually a false choice. The fact of the matter is that being tough on crime actually will not make us safer. And so the notion that incarcerating people is somehow going to prevent crime is just, it's factually untrue. In fact, we've seen that high rates of incarceration can lead to more crime for the reasons that we've all explained. When people are entrenched in the system, it's very difficult to get out, and recidivism includes recommitting crimes in some way or violating parole or probation on a technicality, whatever it may be. And all of the systems that are used in these tough on crime approaches are in serious need of reform as well. Our prison system, our carceral system, the conditions both in the juvenile and adult facilities, our jail conditions, they're abysmal. And those are not places where folks are going to get better. 97% of whom get out and come back into our communities. And so, that's a real problem. Our policing system is in deep need of reform as well. We have one of the highest rates of police violence in the country, pretty consistently. And so, using broken systems to repair deeply systemic problems is just not the solution.
I'll chime in. Hi, Robert.
Hey, Ben, good to see you, sir.
You too. So I really believe that we should approach social issues like this with a do no harm mentality. So first of all, are there people that need to be charged and need to be prosecuted for violating community standards, for hurting others, which is what a crime is supposed to be, right? If you are hurting someone else or hurting the community, there are definitely things that need to be done. There are definitely people that need to be charged, and there are some people that need to be separated from society, which is what incarceration is. But when you use it for instance, the use of drugs, and people, juveniles and adults, are charged, they are put in jail, and they are sometimes put in prison for the use of drugs, which usually makes them worse about using drugs when they are in custody and then when they get out. So it's really short-sighted, not based upon evidence. It's based upon a feeling that we are doing something and that we are deterring people. And so we just have to be smart about it. And we need to be compassionate about it, because again, the people that I represent are my community. We are all part of the same community. This isn't us versus them. And so often I think the tough on crime approach is us versus them. We are punishing them. And it's the same kind of thing we've heard since the 1980s war on drugs. They talk about fentanyl in the same way they talked about crack cocaine. The war on drugs did not solve the drug problem in America. It made it much worse and incarcerated thousands, tens of thousands of people, most of them people of color. And so what I'm saying is you just have to be smart. Don't create more harm. Be thoughtful. Many of the tough on crime bills are not thoughtful, and we are asking that the policymakers be thoughtful.
Thank you, sir.
Hi, this is Elena Mensinger. Thank you guys for hosting this. I just have a couple of questions. A couple of speakers brought up these long wait times and how it makes it difficult for people to get treatment and get access to that treatment. Are there ways for the legislature to help reduce those wait times, potentially trying to boost staffing in behavioral health?
I mean, absolutely. I think it's about investing more dollars into the system. It is also a workforce issue, as you mentioned, and we need to be thinking creatively of how to incentivize more folks to be working in the rural parts of our state and really all over. Having worked in New Mexico for so long, we've always had an issue with behavioral health providers for young people. And I think we should start there and start supporting through, whether that's training and loan forgiveness and all those programs that we know have worked for other healthcare issues, that we need to be putting more emphasis on behavioral health. And it's really what we're seeing now is decades of underinvestment in our behavioral health system. We know that, about a decade ago, we had to really rebuild some of our behavioral health system when a lot of providers weren't available. And so, again, it's treatment on demand, but it's making sure that we have the professionals to provide those services. And I also just want to say that treatment, we need to think broadly about what treatment is. Treatment could mean a safe place to sleep at night, so that, when we address some of those basic needs and services, that's when we see people be able to get better, because you can't stop using drugs if you're living vicariously on the street, afraid of violence, afraid to go to sleep at night. So we see a lot of people using drugs to stay up at night, so they're not victims of violence. So we have to really think more creatively about how to put funding into a broad array of services for treatment.
Yeah, I would echo everything Emily said. And one of the things we're looking at with workforce issues is the livability of our community. So can people afford to live and work in rural communities? Is there enough affordable housing? Are we paying a living wage? So we're really interested in proposals that will address those kinds of issues and help build up our affordable housing so we can have behavioral health providers move to different parts of the state, be incentivized to live in our rural communities and get paid really well to do the work that they do and get paid the wages that they should. And we'll be able to recruit and retain providers and address all those issues Emily was speaking to as well.
Thank you all. And I believe Austin had another question if he's jumping back in. Go ahead, Austin.
Thanks, Naomi. So the discussion this morning has been really good. It's been focused on what lawmakers could and should do in the session that starts on Tuesday. But I want to step outside of that box and ask a hypothetical for anyone on the panel. What is something thoughtful and evidence-based that the executive branch, the governor, could do today, right now, that would make New Mexicans safer?
Anyone? Hypotheticals drive me a little bonkers.
I'll jump in. In the facilities over which the governor has control, to emphasize treatment, to put more resources to helping people succeed on the outside, and that means treatment for drugs, for mental health, and reentry services, so that when they come back into our community, that they have the best chance of success. I think that's something that it's really important to emphasize.
I second Ben's hypothetical.
Yeah, same.
And by the way, none of us are saying it's easy, but that really it's an important thing that the executive branch can do themselves.
Agreed. And I think we should acknowledge that, you know, the legislature and the governor have been increasing investments in all of these types of things over the last few years, and we're really grateful for that. And we see that. And I think that part of what we need to do is now let those investments take effect. You know, there just isn't a short-term solution for a lot of these issues, and so it's a both and approach. Anyone else? Okay, well, thank you all so much for being with us today. We really appreciate the questions. Maria and or Katie will be following up with contact information if you want to talk to any of these folks or myself individually. But thank you all for being here today.